how to make under eye bags disappear. This is one of the most common questions I get asked in my practice. And if you've ever looked in the mirror and been shocked by that puffiness under your eyes, you're probably wondering why this happens, and more importantly, how can you get rid of it? I see so much wrong information out there, so many myths on the internet. And I'll tell you why most of those miracle creams you see advertised are actually a complete waste of money. You're going to be surprised. If you're new here and want to learn everything about eye health, make sure to hit that subscribe button and ring the notification bell so you don't miss anything. Let's start with what you can do at home naturally. Tip number 1, watch your salt intake. A diet high in sodium makes your body retain fluid, and this includes your eyelids. It's not the main cause, but it definitely makes the problem much worse. It's the same reason your eyes swell up after crying. The salt in tears pulls water into the skin. When you consume too much salt, your body tries to balance it out by holding onto water. This extra fluid accumulates in the tissues around your eyes because the skin there is so thin and delicate. Think of it like a sponge soaking up water. The more salt you eat, the more water your body stores, and your under eye area becomes one of the first places to show this retention. Tip number 2, cold compresses. This is classic, but it works. Cold constricts blood vessels and reduces swelling instantly. Forget all the hype about cucumbers. It's not magic, it's just the cold temperature. You can use a cold mask, a frozen spoon, or the good old ice pack wrapped in a thin towel. The important thing is to cool the area. The cold temperature causes vasoconstriction, which means the blood vessels under your skin get smaller. When blood vessels constrict, less fluid can leak into the surrounding tissues, which reduces that puffy appearance. Apply the cold compress for about 10 to 15 minutes at a time. You can do this several times a day, especially in the morning when puffiness tends to be worst. Tip number 3, control allergies. This is huge. Allergies release histamine, which causes tissues to swell and become red and itchy. First rule, don't rub your eyes. It feels good in the moment, but makes everything worse afterward. Second, use those cold compresses again. Third, there are excellent anti-allergy eye drops available. Just a warning, oral antihistamines can dry out your eyes significantly, so watch out for that side effect. Allergic reactions cause your immune system to release chemicals that increase blood flow and fluid accumulation in tissues. When this happens around your eyes, the delicate skin there swells up like a balloon. The more you rub, the more irritation you cause, which releases even more of these inflammatory chemicals. It becomes a vicious cycle. Now, before we continue, can you do me a favor? If you're enjoying this and learning something new, please hit that like button. It really helps me know I'm on the right track. Thanks. All right, now let's talk about what not to do. Those famous under eye creams, there are thousands of brands, serums, creams with acids, anti-aging creams, and I'm not a fan. Want to know why? Most of these products aren't regulated like medications. Many of them use preservatives that studies have proven cause permanent damage to the glands in your eyelids. This not only ruins the delicate skin there, but can cause horrible dry eye disease. And there's more. Creams with retinol, very common in anti-aging products, are the biggest villains for these glands. Consider yourself warned. The preservatives in many cosmetic products can disrupt the meibomian glands, which are tiny oil glands along your eyelid margins. These glands produce the oil layer of your tear film, which prevents your tears from evaporating too quickly. When these glands get damaged by harsh chemicals, you end up with chronic dry eyes, which ironically can make under eye bags look even worse because you'll constantly have irritated, swollen tissues. But then, what's the real cause of under eye bags? In the vast majority of cases, it's pure anatomy. The skin of the eyelid is the thinnest skin on your body. Over time, due to age, genetics, and especially sun damage, the supporting tissue under this skin weakens and stretches out. The result? The fat that sits behind your eyeball starts to push forward, creating that bulge, that bag. Unfortunately, no cream can fix this structural problem. Think of it like a balloon that's been stretched out too many times. Eventually, it loses its elasticity and can't snap back to its original shape. The same thing happens to the tissue that's supposed to hold that orbital fat in place. When this tissue weakens, gravity does the rest and the fat herniates forward, creating those unsightly bulges. This process is accelerated by several factors. Sun exposure breaks down collagen and elastin, the proteins that keep your skin firm and elastic. Smoking reduces blood circulation, which impairs the skin's ability to repair itself. Poor sleep habits can cause fluid retention and put extra stress on the delicate eye area. Even your sleeping position matters. Sleeping on your stomach or side can contribute to fluid pooling around your eyes. And that's why the definitive solution is often surgical. The procedure is called lower blepharoplasty. Basically, the surgeon makes an incision inside the eyelid, removes or repositions that herniated fat, and sometimes tightens the muscle and skin. Since the incision is internal, there's no visible scar. The results are dramatic and permanent. During this procedure, the surgeon accesses the fat pads through the conjunctiva, which is the inside lining of your eyelid. They can remove excess fat, redistribute it to fill in hollow areas, or sometimes just reposition it to create a smoother contour. The procedure typically takes 1 to 2 hours and is usually done under local anesthesia with sedation. Recovery involves some swelling and bruising for about a week or two. Most people can return to work within a week, though you'll need to avoid heavy lifting and strenuous exercise for about 2 weeks. The final results become apparent after about 3 months when all swelling has completely resolved. Of course, surgery is a serious decision. If you're considering it, the first step is to talk to an ophthalmologist. They can refer you to an oculoplastic surgeon who specializes in this type of procedure. These surgeons have specialized training in both ophthalmology and plastic surgery, specifically focusing on the eye area. It's important to have realistic expectations. While blepharoplasty can dramatically improve the appearance of under-eye bags, it won't stop the aging process. You'll continue to age, but you'll look years younger than if you hadn't had the surgery. The results typically last 10 to 15 years or more, and here's the best tip of all: prevention. An ounce of prevention is worth a pound of cure, right? And the biggest enemy of your skin is the sun. So wear sunscreen every single day, sunglasses with UV protection, and a wide-brimmed hat. This will significantly delay the weakening of that tissue and the formation of bags. UV radiation is particularly damaging because it penetrates deep into the skin and breaks down the collagen matrix that keeps your skin firm. The skin around your eyes is so thin that it's especially vulnerable to this damage. Even on cloudy days, up to 80% of UV rays can penetrate through clouds, so daily sun protection is essential. Choose a broad-spectrum sunscreen with at least SPF 30 and make sure to apply it gently around the eye area. Look for sunglasses that block 99 to 100% of both UVA and UVB rays. The larger the lens, the better the protection for the delicate skin around your eyes. There are also some lifestyle factors that can help prevent or minimize under-eye bags. Getting adequate sleep is crucial. Aim for 7 to 9 hours per night. Elevate your head while sleeping to prevent fluid from pooling around your eyes. Stay hydrated, but avoid drinking large amounts of water right before bed. Limit alcohol consumption, as alcohol can cause dehydration and interfere with sleep quality. Both of these factors can contribute to under-eye puffiness. If you smoke, quitting is one of the best things you can do for your skin and overall eye health. Some people find that certain foods trigger puffiness. Common culprits include processed foods high in sodium, dairy products for those who are sensitive, and foods high in refined sugar. Keep a food diary if you notice your under-eye area is particularly puffy on certain days. Regular gentle exercise can improve circulation and help reduce fluid retention. However, avoid exercises that involve a lot of bending over or hanging upside down, as these can temporarily worsen under-eye puffiness. It's also worth mentioning that sometimes under-eye bags can be a sign of other health issues. Thyroid problems, kidney disease, and certain allergies can all contribute to persistent puffiness around the eyes. If your under-eye bags appear suddenly or are accompanied by other symptoms, it's worth discussing with your doctor. So what did you think? What surprised you most in this video? Was it the thing about creams? The salt tip? Let me know in the comments below. If this video helped you, please hit that like button and share it with that friend who's always complaining about their under-eye bags. Don't forget to subscribe and ring that notification bell for more eye health content. Thanks for watching, and remember to take care of your eyes.